In preparation to go over some IV antibiotics, I'm going to give you a quick demonstration on how to put in an IV line for a baby. So the most important thing that we need to do is ensure we have safe positioning and that the baby has as much comfort as possible. So we know it's a painful procedure, but there are some things that we can do to counteract it. So the very first thing I'm going to do is I'm going to swaddle with one arm out. So I start with the arm that's not out, up and around the shoulders, and then I tuck in. And then I go underneath the arm that needs to stay out, and that one tucks in through there. And then I have a nice little area where I can get to my hand. The other thing I'm going to do is ensure I have a little syringe for sucrose, and if the mum's not there to give either a dummy or her finger, you can pop a glove on and you can use your finger to help the baby suckle with some sucrose. A couple of drops at a time should be plenty, and just before the needle goes in. In big people, we like to use the tourniquet, which clips together and you can tighten around. But in little people, we tend to try and keep their arms a little safer, and we can just use a plain piece of gauze. If you lengthen these out, you've got a nice little long bit here, and you can use that as your tourniquet. Giving it a tight little pull, but not too much that you'll injure the baby. The next thing you need to do is look for a vein. You'll get to learn how to do cannulation when you are out as a registered nurse. Nice, clean. And then again, positioning is really helpful here too. So for me, I like to hold the hand and have someone else hold the elbow and the shoulder for me. But for this demonstration, as it's just me, I'll just be holding the hand. Find our vein, pop the needle in, and then we thread our cannula. And then we've got a safety needle here, can go back on our sterile field, and we can connect up a pre-primed line. That's really important with babies that we think about their pressure injury care. To look after the baby's skin and to take care of pressure injuries, we put one of these underneath the hub and we fold it around like this. So we don't have a lot of pressure sitting in with this hard plastic in here. With our special little teddy bear tegaderms, what we need to do is pop it around the pink section, and our teddy bears are actually supposed to sit underneath the hub itself to protect the skin further. And we have a nice little cannula. But as babies don't like to stay still, we often put a hard board behind them. This is nice and soft with a bit of metal that we can bend to keep their arm straight for the cannula to stay in. We use a little bit of tape to keep this one in place.